And it's time now for our In Focus Health Update. Health reporter, our own Linord Moudou, joins us now with an in-depth look at sickle cell anemia.
Hello, Vincent.
Hello.
Hello, everyone. Sickle cell anemia is a blood disorder that deforms red blood cells. The disease is passed down through families, and developing countries are particularly hard hit. Sickle cell anemia is a genetic disorder that causes normal red blood cells to mutate. Dr. Mark Gladwin is the Chief of Vascular Medicine branch at the National Health, Lung and Blood Institute.
Once you have that sickle cell disease, you have two genes for an abnormal sickle cell hemoglobin. And hemoglobin is the protein in our red blood cells that carries oxygen around the body. It's the reason our blood is red. Well, with sickle cell, the hemoglobin is not normal. And when your blood deoxygenates, the hemoglobin gets sticky, so that within your red cell, you form these long polymer bundles or rods that ultimately damage the red cell. The red cell is supposed to be like a donut, and it becomes crescent.
Sickle cell anemia affects millions of people globally. An inherited blood disease, the first symptoms appear in babies usually after 6 months. The baby becomes irritable, starts losing weight, and has a high risk of infection. Throughout their lives, sickle cell patients experience pain, a main characteristic of the disease.
So normally we have blood flowing to our body, bringing oxygen to our organs. With sickle cell, those abnormal red cells plug up and block the blood vessels. And whenever you have a blockage in blood flow to an organ, the organ dies. It's starved for oxygen, and that creates pain. So the hallmark of sickle cell disease is severe bone pain, horrible, horrible leg, arm, chest, back pain, episodes of pain. And the pain strikes when the cells start to sickle.
The World Health Organization says sickle cell anemia is particularly common among people whose ancestors come from sub-Saharan Africa, India, Saudi Arabia, and Mediterranean countries. Experts say the sickle cell trait provides a survival advantage in areas where malaria is common.
Uniform consensus now that if you have sickle cell trait, if you have one of the genes, you're protected from severe malaria. Your risk of death from severe malaria as a child is reduced. And as you know, in areas of sub-Saharan Africa, malaria is so endemic. That's why in these areas, 40 to 70% of the population has one of the genes, because having those genes protects you from malaria.
WHO says more than 200,000 children in Africa are born with sickle cell anemia. The organization says Nigeria alone accounts for approximately 150,000 of those children. Abimbola Aze is a sickle cell activist in the country.
With 7 million Nigerians living with the disease, the federal government and the state governments should do something about sickle cell anemia. Nigeria has the highest number of people in one country living with the disease, and we want people to know about it and to make sure that they do their genotype testing before they get married, so they'll be aware of their sickle cell status.
To date, there is no cure for sickle cell anemia.